Hey everyone at Camelot, time for another video update. I really do look forward to doing these every couple weeks. They're a lot of fun and I got a lot to tell you about this week. So I'll dive right in. The first was something from our newsletter that we put out earlier in the week. That's the endowment fund. We've gotten a lot of questions of what is an endowment fund. So a little bit more about what we've done. The board of directors for Camelot has authorized us to take $300,000 of money that we've been saving and deposit it into the Community Foundation of Tampa Bay in an endowment fund to permanently support Camelot. So what that boils down to is that money will go into the Community Foundation and it will stay there forever. And it will support Camelot through growth and through returns and dividends. When we deposit the $300,000, they will immediately give us $100,000 as match. So right away it'll grow by 1/3 and become a $400,000 endowment, and we'll grow from there through investment returns and dividends. And it is something that we can never touch, but it does produce returns and dividends for Camelot to be able to invest back in programs. It's a really big step for us. It shows that we are committed to looking at our future resources and making sure that Camelot has everything it needs to be able to grow in the future, 10, 15, 20, 30 years down the road. It's also an opportunity for other donors to join us in that effort. There are some donors who like to give to programs and allow those programs to use the money right away. There are others who don't want to do that. They want to be able to invest in the agency and let that money grow and support the agency for a very, very long time. This creates that opportunity. So our board was very forward thinking in this. They debated it and looked at all the opportunities and felt that this was the best chance for Camelot to be able to invest in its future. So we'll be setting it up in the next couple of weeks, and it is, like I said, a really, really big step for us, and very, very exciting. Earlier in the week, I was in Washington, D.C. participating in a public policy institute, and I got to do a lot of fun stuff there. One of them was visit with U.S. representatives and senators to talk about Camelot, let them hear about what we do, advocate for children's services, for laws that are being put out there, like the Families First Prevention Services Act, as well as mental health services. But mostly it's a chance for them to get familiar with Camelot. I took a chance to invite them back when they're back in the district, not in Washington, to come down and see our programs and meet our staff, and hopefully some of them take advantage of it. So it was a chance for us to show what Camelot does and educate them about the great work we do here. The second thing was I was with 100 other leaders from around the country and got a chance to share ideas and look for opportunities for Camelot to grow and meet our mission. Came out of there with several ideas. Two of them we're already looking at, more on that down the road as they become a little more solid. But there was some great opportunity for me to be able to with other leaders and network about what is the important things that we can look at for Camelot and what can we do to improve our services here. Another item I wanted to talk about was health insurance. We announced in the newsletter that we are switching over to United Healthcare. Big decision. This has been a week of big decisions. And what that is about is a chance to save some money on the health insurance plan, and our ultimate goal, hopefully, is to lower the cost for family insurance. That's not going to happen right away, but it is something that we are always have been a goal of ours. But the big change in the plan is basically this. So right now, the insurance company charges us per employee. They say you're going to pay us for every employee that's on the plan. It's around $600 a month. We then go to the doctor, go to the hospital, get procedures, do whatever, get physicals, do whatever it may be. The insurance company pays those claims. If the claims are less than all the premiums we paid them, they keep it. If the claims are more than the premiums that we pay them, they have to pay those. They're completely at risk. Camelot has no risk in that whatsoever, other than we have to pay for a high cost of health care. And if there is savings, then we don't get to see any of that. So for the last 4 or 5 years, we have had no increases in insurance, and I think even last year we reduced the cost of insurance slightly for employees. But every year we pay about $3 million for insurance, and we have about $2 million in claims. That $1 million is what Aetna at the time gets to keep. We don't get to see any of it. So we're switching to a model that's called a self-insured model. So the insurance company charges us an administrative fee for every single employee. We then pay that fee, and then as claims happen, they send us a bill every month, or every week for that matter, that says, here's all the claims your company occurred this month, send us the money, and we pay the claims. If the plan operates just like it's been for the past 4 or 5 years, we will save hundreds of thousands of dollars in claims that we pay, and we get to keep the difference between the premiums and claims, where previously the health insurance was keeping that money. So it's a big step, and it's literally us taking control of our health insurance plan. So all of us as employees control the cost of our health insurance plan. Do we make choices like go to the emergency room or go to the urgent care clinic? Do we participate in the wellness program? The healthier we are, the lower the cost of the health insurance, the better we are able to reinvest that savings into the health insurance plan. And we know that if we can lower the cost of family insurance and spouse and dependents, it will change the type of employee that we can bring here. We know right now that there are some folks looking for positions with Camelot that don't come because of the cost of health insurance. We're looking to make an impact on that. It's not going to be tomorrow. It's probably going to take a couple of years, but it is something that we are actively involved with now, and it's a big decision for us. And we'll be putting out a lot of information about how that works. For you, there's no change except for United Healthcare. You go to the doctor, you present your insurance card, you pay deductibles or co-insurance, and then we take it from there. They send us the bill and we pay the claims directly. So for you, it'll be seamless. Switch to United Healthcare is going to be a great switch. They're a great health insurance company. We've previously had them, so it'll really, really be good for Camelot. The next thing I wanted to be able to bring up is strategic planning. So our corporate team here, our administrative team, met on Wednesday. We just about finished our company-wide plan, and I know each one of the programs is looking at their plans as well. I've seen some of them. They look really, really good. I've heard from staff that are really getting into it and enjoy being part of the conversation. That's the main goal of doing strategic planning. Once they're all back, we will compile those into one company plan. We will send it out for you to see. You'll have a chance to review it and see all of the great ideas that are out there for what we can do the next 3 years to bring Camelot to the next level. That's what it's all about. So there are some really, really cool stuff in there, and I can't wait to share it with everybody. Like I said, that'll probably be July when it does come out, and it'll really be something that you are going to enjoy. I want to thank the 14 people right now who have participated in the It Starts With Us employee campaign. That's really fun to see, and every week we get more and more. Thank you for making that commitment to help Camelot and show your interest in us becoming a better agency. That's, there's no literally putting your money where your mouth is, and so that is a great commitment on your part. So it's Friday before Mother's Day, so I want to be able to wish all of the mothers happy Mother's Day. Enjoy your weekend. We appreciate everything you do for Camelot. We appreciate everything you do for families, and I look forward to talking with you at our next video update.